Hi, this is Dr. Mark Bowen Taylor. Today I would like to tell you about the treatment of pitted, ice pick, and rolling acne scars. This patient has predominantly pitted scars or ice pick scars. We're doing a blending chemical peel as an additional treatment. Here we're using a focused erbium laser to precisely ablate the center of the pitted acne scars. This is better than TCA cross because the healing can start immediately after the scar is ablated. This is done with a special handpiece and a very small beam on the erbium laser to be able to precisely only ablate the pitted acne scar and not the surrounding skin. We also like to use the erbium laser with a fractional tip to blend the edges that are raised on scars, and then we make the area numb and make a small incision and use the Taylor Liberator to go underneath the skin and treat the rolling acne scars. This also releases the tension on the skin so that the pitted scars can also heal better. We like to apply pressure to reduce the risk of bleeding or bruising following the treatment, and then we use one of several different fractional lasers. Here we're using the fractional CO2 laser. We then apply an oxygen dome and red light to initiate healing, and a mask over the first night to give the patient comfort. Here's the patient 1 week after treatment. And this is another patient with pitted acne scars we've treated. Here's another one 14 months after treatment. And here are rolling scars that we've treated. It's interesting that even older people who had bad acne when they were young are severely bothered by the continued memory of the horrible acne and the way that it upset their life and things they wanted to do at that time of their life. We have treated thousands of patients over the past 14 years for acne scars. Our average improvement is around 70% in a single treatment. Sometimes additional touch-up treatments are necessary to achieve the amount of improvement that a patient would like. These are the doctors at the Gateway Aesthetic Institute and Laser Center that do this treatment: Dr. McLean, Dr. Hurth, me, and Dr. Fisher. Thank you for watching.